My name is Joanne, and I want to welcome you to the very first episode of the Joanne's Wellness Hub, which is a platform that seeks to educate you on matters health. So, on this platform, we learn, we unlearn, and we relearn. So, I'll be doing these teachings in form of series, and the very first topic that I really want us to cover is on acne, and I will have a few episodes on acne. To start with, I just want to do an introduction into understanding what acne is, and mainly the skin, so that you may be able to understand the basics of anatomy, or rather of acne. So when you're talking about the skin is mainly the largest organ in our body, and it is composed of three main layers. So we have the epidermis, and the epidermis is the outermost layer of the skin, whose function is mainly protection, and it is composed of what we call keratinized stratified squamous epithelium. Okay, and then we have the dermis. The dermis is the layer just beneath the epidermis, and its main function is mainly providing structural support, and it is composed of different structures, and these structures include the connective tissue. We have the sebaceous glands, the blood vessels, then we also have the sweat glands, the nerve endings, the hair follicles, and I don't know if we've mentioned the sebaceous glands. And then we have the last layer, which we call the hypodermis, and the hypodermis is also referred to as the subcutaneous tissue, and it mainly is composed of the fatty layer, and also it is composed of the loose connective tissue. Its main function is mainly insulation and energy storage. So when you're talking of acne, three main structures are involved in its pathogenesis. So we have the sebaceous glands, the hair follicles, and also we have the sweat glands. We know that sweating mainly helps to excrete toxins from our bodies, and so the sweat glands mainly helps in with the excretion of the toxins. And then we have a natural oil that we mainly call sebum. Sebum is the natural oil that mainly moisturizes our skin, and it is produced by the sebaceous glands, and then after its production, it travels on the surface of the skin through the hair follicles, and the hair follicles open on the skin, through the skin, by what we call the pores. So when you're talking about the pores, they are mainly, most of them are the openings of the hair follicles. So sometimes you find that there's overproduction of sebum, and when there's this overproduction of sebum, it can clog the pores, and when these pores are clogged, this mainly causes acne. And definitely we have different kinds of acne, and patients with a different kind of acne, they manifest differently, and we will look at these different kinds of acne. Then we have 5 different kinds of skin types. The first one is a normal skin. A normal skin is where you find this balanced production of sebum, and these people with this type of skin, the skin is mainly smooth with minimal imperfections. And then we have a dry skin. A dry skin is where you have very minimal production of sebum, and so most of the times people with this kind of skin type have flaky and very dry skin, and this kind of skin type people with this kind of skin type tends to age faster. And then we have an oily skin. An oily skin is where now you have overproduction of sebum, and most of the time you find the skin very shiny with a lot of oil. And then we have a combination skin. A combination skin is where you find the person having an oily skin on the T-zone. The T-zone is when you draw a T on your face. So you find an oily skin on the forehead, the nose, and the chin. And then on the other parts of the face, you have either normal or dry skin. So that is for the combination skin. And then we have a sensitive skin. So people with sensitive skin are mainly the skin is quite sensitive to different products. So definitely you can either have a sensitive or an insensitive skin. So people with sensitive skin, you find that harsh products may irritate the skin and cause breakout. So you can have a combination skin that is sensitive, an oily skin that is sensitive. So it is important for you to understand that. Thank you.